Hi everyone, and welcome to part one of our Future Proof Your Diabetes workshop. And in this workshop, we're going to be talking about the different types of diabetes. And I wanted to ask everyone before we start, how many types of diabetes are you aware of? So most of us are really aware of type 1 and type 2, but there are so many others. And that's what Merryn's going to be discussing with us today.
Okay, great. Thanks, Laura. So essentially, most people, as you say, are aware of type 1 and type 2, but there's actually type 1A, type 1B, type 2, and then we move into type 3. And type 3 goes all the way from type 3A to type 3H. H. And then there's type 4, which is gestational diabetes in a class of its own. And Laura and I will be discussing that in a video of its own.
Yes.
So I might just start with type 1. So type 1A diabetes is where there's autoimmune antibodies in the bloodstream that are measurable. And so we will often do a blood test when we're trying to determine what kind of diabetes somebody has. And that blood test really involves looking at these antibodies to the pancreas. So remembering that the pancreas is the organ in the top of the abdomen that produces insulin. And insulin is the protein or the hormone that's required to get your sugar or your glucose into your cells for energy. So if you don't have enough insulin, or if the insulin can't work properly, then you'll get a high blood sugar.
Now, these antibodies, what we can test for, is this something that your GP can do?
Absolutely.
Yes.
So certainly in most countries, they will have some of these blood tests available for antibodies that are involved in type 1 diabetes. And they're really antibodies. And remember that antibodies are those immune proteins that generally attack bacteria or viruses or germs. But unfortunately, in a lot of conditions that we call autoimmune conditions, the body for some reason doesn't recognize a part of the body as its own. And it attacks it as it would a bacteria or a virus.
So in type 1 diabetes, the antibodies attack the cells that make insulin.
That's exactly right. And so in the pancreas, the cells that make insulin are beta cells, and they are in islets. And so these antibodies are often to the islets, which are the little islands, or to parts of the beta cell themselves. So that's what we measure. Now, you can have type 1 diabetes but have a negative antibody test.
Yes.
And that may be because you've had it for a while and your immune system has actually managed to clear the antibodies. So you might have had them at diagnosis. But if we're 10, 15, 20 years down the track and we're trying to measure the antibodies later on, your body may well have cleared those antibodies.
And that would be type 1B, correct?
So that's exactly right.
Yes.
So when you look at type 1B, that's when we do that blood test, but we can no longer measure the antibodies. There's a little bit of conjecture there then whether or not it's type 1A or type 1B, because it could still be type 1A, but you have
Just
cleared
don't
the
have
antibodies.
anymore.
Yeah. But there are a subset of people in type 1B who never had the antibodies, and that may be because there are antibodies that we don't know about, that we don't have a test for and can't measure for.
Yes.
Or that there is another kind of immune response involved that doesn't necessarily involve the antibodies. The type 1B is often called LADA or type 1.5 or latent autoimmune diabetes in adults. And so you may well hear those terms as well. And the reason we came up with this type 1.5 or type 1.5 is because some people with type 1B, type 1.5, LADA, won't have the antibodies, definitely have the picture of type 1 diabetes, but also have some insulin resistance. And this is where we move into more a type 2 picture. So insulin resistance is where there's insulin, but it can't actually get into the cells effectively. So I kind of like to think of the insulin as the truck transporter, if you like.
Yes, this is my favorite
for
analogy.
glucose or sugar. And so you need the insulin to take the glucose or the sugar and put it into your cells.
Yes.
Yeah. So if you don't have enough insulin or you've got insulin resistance, then obviously you can't get that sugar into the cells.
Right, so something's blocking the truck from being the transporter.
That's right. So that's the insulin resistance, is the blocking of the truck. Yeah. And so type 1.5 or LADA or type 1.5 may well involve this insulin resistance. Yeah. So that moves us into type 2 diabetes, which really is characterised by insulin resistance.
Yes.
So in the beginning, early on in the diagnosis of type 2 diabetes, people still have quite a lot of insulin, and often they have higher levels of insulin.
Yes.
And this is another blood test we can do.
Mm-hmm.
So we'll often do a blood test for fasting C-peptide,
Yes.
which is a small portion of the insulin molecule,
Mm-hmm.
and insulin and glucose. And we do like to do them together.
So it gives it context.
That's exactly
So you
right.
can see what C-peptide they're producing in relation to their glucose to
That's
see if it matches.
exactly right.
Yes.
That's right, Laura. So if you've got a really high blood glucose or blood
Mm-hmm.
sugar, but then you've got a really low C-peptide and insulin,
Mm-hmm.
that tells us that you're insulin deficient.
Mm-hmm.
Yeah, you don't have enough.
Mm-hmm.
But by the same token, you can have a really high
Mm-hmm.
blood glucose and then also have a really high C-peptide and insulin level.
Mm-hmm.
And that tells us that you're very insulin resistant.
Mm-hmm.
Yeah?
Yeah.
It gets a bit tricky because if you've had diabetes for a long time,
Mm-hmm.
type 2 diabetes for a long time, you can actually become insulin deficient.
That's true, and this is where you need specialist involvement, but absolutely.
That's right. And so that moves us then into type 3. And I think there's been a little bit of media attention recently to type 3.
Yes, there's been a few articles, I think, in The Guardian and in the Herald. Yes.
That's right. So type 3C has been getting a bit of press.
Mm-hmm.
And type 3C is a type of diabetes where the pancreas is damaged, but it's often damaged through a toxin or another medical condition. So,
Interesting. Okay.
for example, alcohol can
Yes.
damage the pancreas,
Mm-hmm.
and that then can cause type 3C diabetes.
Now, when you say alcohol can damage the pancreas, is that binge drinking or excessive drinking over a long period of time? Is there a difference there?
There is, but we think that in fact binge drinking,
Mm-hmm.
because it's a cumulative exposure, so
That's true.
if you binge drink enough, you're
Mhm.
going to damage your pancreas enough over time.
So even if it's just a Saturday night, it's not all week.
Yeah.
If you do it for long enough.
That's right. If it's
Yes.
a lot of alcohol, then
Mhm.
yeah,
And
absolutely.
what would be a lot of alcohol?
So the now this is a bit tricky because
Okay.
the safe drinking guidelines
Yeah.
change quite frequently as we get more information in the literature,
Mhm.
and more recently they've decreased safe levels of alcohol intake.
Oh, they've decreased.
They have. So
that's
for
really
women
interesting.
now, it's actually 1 standard drink or 10 grams of
Mhm.
alcohol
Mhm.
per day, 5 days a week.
Mhm.
And for men, it's 20 to 30 grams of alcohol
Okay.
per day, 5 days a week.
Okay, so if you're having 10 or 15 beers on a Saturday night, that's far and above.
Absolutely.
What's recommended.
So
Mhm.
one beer generally is 1.5 standard drinks, so it's
Mhm.
about 15 grams.
Mhm.
So 10 beers is 150 grams. So
Right.
you're well and truly above.
Yes. So that
Um,
kind of exposure over a long period of time could lead to type 3C.
Yeah,
Yes.
And again, it is an exposure
Mhm.
issue over time.
Mhm.
There's also a condition called cystic fibrosis, which is a genetic
Yes.
condition.
Yes.
And people are aware of cystic fibrosis affecting the lungs, but it
Mhm.
can also affect
But
the pancreas
as well.
and create insulin deficiency there. So that's type 3C, yeah. So looking now at type 3A diabetes, type 3A is a really interesting group.
Okay.
So this is what we previously called MODY, or maturity onset diabetes of the young.
Mm-hmm.
And people saw this diabetes in kind of teenagers or young adults, and they often were a bit overweight,
Right.
but they didn't really fit with type 1 diabetes
Or really
even
type 2. Yes.
Yeah.
Mhm.
And so they were classified as MODY initially and different types. And over the last decade or so, we've actually started to discover that there are specific genes associated with these conditions. So there are particular genetic issues associated with these, and we've started to reclassify them now. So instead of MODY 1, MODY 2, MODY 3, and there's, I think we're up to about 18 or more now.
So it's important to know if you do have MODY, that it's not type 1 or type 2, that it is MODY because of the other genetic risk factors.
Yeah, so
Is that correct?
there's other associated conditions with some of them. So for instance, what we used to know as MODY 5 has some kidney problems with it.
Yes.
But also these different types of diabetes often don't respond to the medications that we've used traditionally, and sometimes don't respond to insulin. So it's important to know what they are. And as I said, there are genetic tests for these now. They can still be a little bit difficult to access, and they can be a bit expensive.
And is this ordered by the specialist?
Yeah, well, GPs can access them. So in Australia we have general practitioners who are primary care doctors, and they can access them. They're still quite expensive in Australia, these tests. So it's often a good idea, if we feel that someone has this kind of diabetes, to refer them to a big diabetes centre where they may be able to access these kinds of
Because once
tests.
you get the test results back as well, they also have to be interpreted. Is that correct?
That's exactly right, yeah. And you really do need a specialist to interpret those and to know then what treatments.
What to do with it once you have the information.
Exactly. So MODI's quite interesting, and we really do reclassify that now as the type of gene. So you might hear glucokinase gene as one of the MODI, and Laura was saying before we started the video that we see that a lot in pregnancy.
Yes.
In women, we start testing people in pregnancy, obviously, for blood sugar when they may not have been tested at any other time in their life, and we find that their fasting blood sugars can sometimes be high in this glucokinase gene issue. So that's an important one. And then the type 3B, there's some other genetic conditions which I won't go into, but Laura and I have provided a PDF detailing all of these types of diabetes attached to this workshop, so please do access that. And you may well find that that's a really helpful resource to take to
print out and take to your GP. And then you can point out and say, this is, I've just watched this video with Merryn and Laura, and this is what we discussed, and you can point it out right there. And sometimes we find that that's really useful in consults.
Absolutely, yeah. And so moving on now, we talked about type 3C. Now type 3D is what we call endocrinopathies. So as an endocrinologist, we see a lot of conditions that can cause high blood sugars that we can actually reverse and hopefully cure. And these may be things like Cushing's syndrome, an overactive thyroid, hyperthyroidism, these kind of conditions. We also see this kind of diabetes in hemochromatosis, which is an iron overload condition. And then type 3E is actually medication related. So there are some medications
like prednisone.
Prednisone, yes, absolutely. Prednisone behaves as Cushing's disease does. It provides you with a very high level of cortisol equivalent in the body, and absolutely that puts your blood sugars up. There are some other medications that have been implicated in diabetes, such as thiazide diuretics is one that's quite commonly used. And some of the older medications, and again that's on the PDF if anyone's interested to have a look at those. Type 3F is infections, and probably the ones that we see would be cytomegalovirus or CMV. Rubella would be another one, congenital rubella. That can damage the pancreas. And those generally are diagnosed often in childhood, but can be later on in life if people haven't been vaccinated or haven't had immunity and have had these conditions. And then we move into some really rare types in 3G and 3H. There's some other genetic syndromes, and perhaps Down syndrome people will be aware of.
Or Turner's.
Turner's syndrome. There's a whole series there, again in the PDF.
Okay, so we really hope that was helpful for everybody, that it showed you the different types of diabetes that there are, and maybe it highlighted some questions for you to look into further what type of diabetes you may have. So what we really encourage is for you to look at this PDF attached to this, to part 1, to print it off, to discuss it with your healthcare provider, and generally for my patients, I always say it's very important just to ask the question, even if you're not sure. Start the conversation, and then you can start to really personalize your diabetes and your treatment, and get the best care you can.
Fantastic. So thank you for joining us today, and we hope to see you in our next video.
Part 2. Thank you.